We told you about this big plan from the health secretary to phase out all artificial dyes from the food supply by the end of next year. A big task expected to be met with resistance from the powerful food industry. But the FDA says it's going to work with Big Food to eliminate some of the dyes by the end of next year. The agency is saying it's going to authorize 4 new food dyes in the coming weeks, which it says are derived from natural sources. I spoke to FDA Commissioner Dr. Marty Makary about that effort and much more. Commissioner, thanks for joining us on this. Appreciate it. Great to see you.
You too.
So the FDA announcing this plan, as I mentioned, right, to remove these artificial dyes from foods and drinks. You got the health secretary also saying that there aren't really any kind of formal agreements. Instead, there is kind of just more of this plan. We know the secretary has also accused FDA workers of kind of doing the bidding of Big Pharma and Big Food in the past. What is enforcement of this new policy, this new guidance from the FDA actually going to look like?
Well, Yasmin, I can tell you that this has been an exciting week. We made this announcement to take these steps that will effectively remove all petroleum-based food dyes from the U.S. food supply. We are removing the authorization on 2 of them in the coming weeks. One of them has already been, another one has been announced, and we're moving up that time frame. And for the remaining 6 petroleum-based food dyes, we've asked the industry to work with us. You know, I believe you get more bees with honey than fire. And these are good people at the top of these food companies. They've got kids, too. They see the demand to want to have artificial food dye-free food. And so they have said that they can make a lot of these changes in the next year to 18 months. So we want to work with them, and we want to see this transition, asking the basic question, can these food companies remove these petroleum-based dyes and replace it with natural ingredients for American kids, just as they already do for Canadian and European kids? And we're also authorizing 4 natural ingredients that can be used as substitutes, and that authorization will come from the FDA in a couple months.
So I think here's the concern overall, Commissioner, with this is a lot of these companies, you know, their bottom line is about money, right? And this is going to cost them and lose them a heck of a lot of money in the interim in this transition, right? So how are they able to justify this? Or does that mean there's going to be price hikes on their end to make up for the loss, essentially? And what do they see the upside is for them?
Great question. I'm glad you asked it because, as you know, this administration is very laser focused on keeping prices down for everyday Americans. There's a precedent. If you go to Europe, if you look at the foods that are made for both Canadian kids and American kids, there's no difference in the prices. And that's why it's important for us to work with the industry and not come down and say, tomorrow we want these out of the food supply. They can make these transitions. Remember, these petroleum-based dyes, they cost money to put in there. And so if we say we don't want these petroleum dyes, we're basically asking something that they can slowly transition out of in the next year and a half. And we're hoping to see that.
We know that there are major links between formaldehyde and hair products, menthol cigarettes as well, to cancer, to causing cancer, I should say. Where are we on the FDA working to ban these types of products, something that we've been watching?
Look, as a part of the Make America Healthy agenda, focusing on a healthy environment for kids. Remember, kids are growing up in a toxic soup now, and it's no coincidence that all these chronic diseases are going up. We're doing an inventory of all concerning chemicals that surround a kid. And so we're doing a big inventory. You're going to see more announcements like the food dye announcement this week. And I can tell you that this is something that brings people together, right? This is not a partisan issue. It's been known that red dye number 3 causes cancer in animals for 35 years before there was any action. So we're taking broad action here, and we're unafraid.
Commissioner, when it comes to formaldehyde, when it comes to menthol cigarettes, any movement on that?
We're looking at all of it. I've been in office now for about 3 weeks, but I can assure you we're looking at all of it.
I also want to talk about the layoffs. I know they're affecting the FDA. You got a lot of Americans concerned that some of these changes that you want to make to, quote unquote, make America healthier are going to be harder to put into place, to enact, because of the layoffs that are happening at the FDA. How do you respond to that?
Well, we're trying to become an efficient FDA because the FDA has had so many silos with redundant, duplicative services. Each center has had their own travel office, their own communication staff, their own lobbyists to Congress. And so what we've consolidated in some of this restructuring is we have reduced in force employees that are communications, IT, and legislative affairs. We have not cut any scientific reviewers or inspectors. And so we want this organization to function with teamwork, not in silos. And we don't think there's a need for so much decentralization when it comes to so many of these services. So I think it's important when people talk about the reductions to recognize an important context. The FDA in 2006 had 9,000 plus employees. It had 19,000 just a few months ago. We didn't live in an unsafe country in 2006. So some of that increase was justified to correlate with the increase in scientific knowledge. But it is in context a small reduction relative to the 100% increase in headcount over the last 17 years. And I think that's an important context. This is a smaller reduction for HHS than Bill Clinton made at HHS when he was president.
As you're talking about cuts, Commissioner, I got to ask you this, because I know that the FDA also relies on research that's happening in a lot of our top universities across the country that are carrying out major scientific research. There have been major cuts, obviously, to these top universities amidst the Trump administration's attack on Harvard, Columbia, Penn, so on and so forth. Are you worried about the loss of this scientific research, of these labs getting shut down that are fueling the FDA and their potential changes to make America healthier again?
Well, as you know, the FDA is not involved in those research grants, so I can only comment on my focus at the FDA as regulators, as the organization within the government that regulates 20% of the U.S. economy, including food, drugs, devices, wearables. What we are trying to do is focus on cures and meaningful treatments and focus on healthier food so kids don't need to be dependent on medications for their asthma, obesity, attention deficit disorder. And maybe the food dye ban could lower the attention deficit disorder rates a little bit. We'll see. There's no one poison in the food supply that accounts for the chronic disease epidemic. But I think it's one step, and it shows that we're serious about taking a serious look at every ingredient in the U.S. food supply.
While I have you, Commissioner, I just got one more question for you. I want to ask you about vaccines, because you said even today that you would welcome a move by the health secretary to withdraw the government's recommendation for children to get the COVID vaccine. We're hearing that the FDA is actually, or could be, I should say, slowing the pace of those vaccine approvals. Are you worried about how this could perpetuate misinformation when it comes to the vaccines? I look specifically to, of course, the breakout of measles across this country right now, in part due to people that are, in large part, I should say, due to people that are unvaccinated.
Well, first of all, just to point out, I didn't say that I would welcome it. I said that if there were a change to the COVID vaccine schedule for young, healthy kids, I feel that that would be welcomed by the public. 85% of healthcare workers said no to the COVID booster in the last round. So I think when we're talking about vaccines, we have to look at the evidence, where there is evidence, where there's no evidence. I believe in vaccines. I've been very clear. Vaccines save lives, and any death from a vaccine-preventable illness is a tragedy. At the same time, let's remember that Mennonite community where there was a measles outbreak, they haven't been vaccinated in over 200 years, since 1799, when the first smallpox vaccine came out, which I wrote about.
But Commissioner, you know it's not just the Mennonite community in which you have vaccine misinformation that is spreading throughout the country, right? You have communities all throughout the country that are dialed in to vaccine misinformation, that are not getting vaccinated appropriately in helping spread some of these illnesses.
Well, these are communities that have not gotten vaccinated for a long time. So what I'm saying is, I know where you're going with this, to peg it on the Secretary of Health that's been there for 6 weeks, when the Mennonite community for hundreds of years has not gotten vaccinated. We have to put things in context. There's been outbreaks in migrant communities from undocumented migrant children in the United States. There was one in Chicago this past fall. They've been going on each year. They are tragic. But let's also talk about the fact that 40% of American kids have a chronic medical condition. I know there's been nonstop coverage over the measles outbreak. Let's also put things in context and talk about the fact that 1 in 7 kids now is on medications. So I think we have to look at health in the childhood area holistically and look at the entire picture.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app, or follow us on social media.